Hey guys, Aaron here with Functional Aesthetics in Eau Claire, Wisconsin. So in today's video, I am going to be demonstrating a couple of yoga poses that you can do to help assess for musculoskeletal imbalances. Specifically, two common ones that you see a lot, which is upper cross syndrome, characterized by imbalances in the shoulder girdle and thoracic spine, so the upper half of your vertebrae is the thoracic spine, and then also in the lumbopelvic hip girdle region. So your lumbar spine, the lower portion of your spine, as well as the pelvic region and the hips. So my interest in corrective exercise in yoga stems from after experiences with various different clients who would have pain in their neck, back, knees, ankles, whatever it was, that was preventing them from participating in a regular exercise program. Beyond that, I also suffered an AC joint sprain about a year ago, which further increased my interest in making sure you keep the longevity and in your exercise program. So to not only be able to get fit, but also to stay fit, because you're building a solid foundation and keeping the muscles surrounding your joints in balance so that you're not causing friction, excess wear and tear over the years. You also see another reason that I got into this was because you see a lot of that in general in society. People have, they get headaches, they get neck pain, they get TMJ, lower back pain, they're getting knee surgeries, hip surgeries, all that kind of stuff. Some of it is age related, but and some of it is diet related, some of it is sports related, but a lot of it is just due to years of improper alignment in their body, causing extra stress and wear and tear on the joints and causing their joints to wear out faster than they need to. So in this video, I'm going to, hopefully, if time allows, go over 4 different exercises. So two for upper cross syndrome and 2 for lower cross syndrome. And if you're not sure exactly how those are characterized, don't worry, I'll be explaining exactly what those are. Explaining force couples between muscles that act on the hips as well as in the shoulder girdle. And then in subsequent videos, I will be showing yoga poses that not only help to detect imbalances in the musculature, but also to help correct those imbalances so that you can actually have better gains, whether you're a bodybuilder in the gym trying to get larger muscles, whether you are an athlete trying to run faster, have peak performance, or you're just a mother or employee of any sort of facility at an office or something like that, who just wants to live a higher quality life, have more energy, less aches and pains, and just improve overall function. So whoever you are, this is going to be great stuff for you. And without further ado, we'll get into the video. Alright guys, so before we get into the force couples and the exercises to help correct upper cross syndrome and lower cross syndrome, I think it'd be a good idea to begin the discussion with a starting point of what constitutes ideal posture and postural alignment. So from the graphic at the beginning of this slide, you can see that if you were to take a vertical line and run it through your body, it should be able to line up with 4 different points, or 5 different points. So you have the tragus in your ear, which is basically this little portion here in the side of the ear here, opposite the earlobe. Should line up with that. Then should line up with the acromion, which is basically the top part of your shoulder joint, formed by the where the shoulder blade of the scapula wraps around, forms the roof of your shoulder joint, and the humerus comes up underneath there. So it should go through the tragus, through the acromion, and then down through the greater trochanter in your hip. So the greater trochanter is the one of the top parts of your upper leg bone, your femur, and you can find that by putting your couple fingers right on your hip here, lift to one leg off the ground, and then rotate your leg back and forth like so. And when you feel the joint rotating underneath your hand, you found your greater trochanter. So then from your hip joint, you go down, and that line should pass right through about the middle of your knee on this outside here. Then going from there, it should pass down through the transverse tarsal joint, which is basically the top of your ankle joint just in front of where your lower leg bone comes into the joint there. And that's what ideal alignment should be. Now, in subsequent slides in this video, I'm going to show how that alignment can be thrown out of whack by different muscular imbalances, and that will be where I will discuss force couples in the next slide. Okay, so in this clip you can see that it is a clip of the showing the force couples working at the pelvis. So the reason I did that is because the first thing that I'm going to be talking about is lower cross syndrome, which has to do with the lumbopelvic hip girdle. So primarily acting at the pelvis, although if you've watched any of my previous videos, you know that misalignment at the pelvis can also affect alignment up in the shoulders as well. So you can see from the diagram here that the muscles that create the force couples acting on the hips are the rectus abdominis in the front and the hip flexors in the front on the bottom. And then opposite that, you have the erector muscles in the lower back, and then you have the glutes in the lower region there. So in the front, the rectus abdominis actually pulls up on the pelvis and crosses or corresponds in the back with the glutes, which pull down on the pelvis, effectively creating a level scenario with the pelvis. Now that can get, and then in the front, you have the hip flexors that pull down on the front of the pelvis, opposing the action of the rectus abdominis. And in the back, you have the erector spinae muscles, which oppose the action of the glutes in the back as well by pulling up on the pelvis. So in the next slide, I'm going to show, or pictorially, what lower cross syndrome is comprised of. And then I will show you some yoga poses that you can do to help assess whether or not you're having difficulty in this area. Especially early on, you might not notice it. In the later stages, you have almost what you call Donald Duck butt, where your butt sticks way out in the back. But in the early stages, it might not be quite as noticeable. So in this video, I'll be showing 2 yoga poses to assess for lower cross syndrome. And then in a subsequent video, I will show you some yoga exercises you can do to help restore proper balance to the hips and get rid of that lower cross syndrome or Donald Duck butt syndrome. And then in the following video, I'll do one on upper cross syndrome, kind of in the same format as I will first show the exercises to help assess for it, and then also some exercises to help correct it, as well as explaining what it is to begin with. In lower cross syndrome, tight, short hip flexors work to pull the pelvis down in the front. The problem is further exacerbated if the abdominal muscles are also weak. In the back, weak gluteal muscles in combination with strong lower back muscles cause the pelvis to be pulled upward
in the back. To compensate for the forward tilt of the pelvis, the lower back arches excessively to elevate the chest and keep the line of sight level with the horizon. This puts extra stress on the lower back.
Okay guys, so the first exercise we're going to look at is the standing forward bend, which is basically just bend down and touch your toes. A couple differences here is in how you go about doing that. This is a great one for assessing for lower cross syndrome because it shows any restrictions in the lower back, hip region, as well as the hamstrings. Okay, so to begin this exercise, we're going to stand feet about shoulder width apart, and you're going to lock your knees out, taking a deep breath, then hinge from the hips. So keep your knees straight. And then as you get to the point where your hamstrings won't allow you to go any farther forward, start to bend in your lower back region. Point your head down towards the ground. Alright, so as you can see from my demonstration there, I do have some restrictions. Another one that I didn't mention right off is that you can also have restrictions in your calves as well. So it's not just the hamstrings, lower backs, and the hip region here, but if your calves are tight, that's also going to affect your flexibility in that area as well. So your calves can affect flexibility in the hips. So ideally, when you bend down like that, as you can see, I was kind of off at a little bit of an angle. My head was kind of pointing off at maybe 45 or something like that. But ideally, you'd like it almost a vertical between your neck and your head to the ground. And then your head should be just, maybe 6, 7, 8 inches above the ground if you are perfectly flexible in that area. So with that, we'll get on to our next exercise, which is another basic yoga pose called downward facing dog. And I'll explain why restrictions to look for in this area and how it affects flexibility in your hips in the next slide. Okay, so this next exercise, downward dog, can be used to assess for both upper cross and lower cross syndrome. In this particular clip, we're going to discuss how it affects, or how you can pick out lower cross syndrome, and then in the next sections we'll discuss how it affects upper cross syndrome. So to set up for downward dog, you start with your hips stacked over your knees and your shoulders stacked over your hands. From there, you can move your hand out so that the palm of your hand is where your fingertips are currently. So one hand breath. Then from there, you're taking a deep breath, roll your feet under, and then lift your hips, lock your knees out, try to touch your heels down to the ground, and then you're going to sink your shoulders down as you lock your elbows out. And then breathe. And in the shoulder area, you want to try to push your shoulders down. So lock out, rotate your shoulders down and back. Just like so. All right, so as you can see, again, that anterior pelvic tilt restrictions in the hips showing up again in my downward dog. So ideally, you should be able to plant your heels firmly against the ground when you're doing that movement. And as I mentioned before, if your calves are tight, you're going to have a little bit of problems with that. So a little aside here, doing movements like that can also help improve your squat, greater flexibility in the ankles, and also in the hips. So then from there, you go up and you see how my lower back was kind of rounding a little bit rather than being extended or hyperextended, with the butt kind of pointing up in the air, had that slight little bend in the lower back. So again, showing tightness in the lower back region, tightness in the calves, slight tightness in the hamstrings, although not quite as much as the calves and the lower back. Alright, so if you made it this far, I want to congratulate you on your patience. There was a lot of technical information in there, but hopefully it was beneficial to you. Be sure to stay tuned for my next video where I'll be showing the more yoga poses on how to correct lower cross syndrome, as well as the video following this where I show how to assess for and correct upper cross syndrome with some yoga poses. If you liked this content and you'd like to see more content like this, be sure to subscribe to my channel. If you do subscribe to my channel, hit the bell icon and so that you don't miss a video when it comes out. If you have any questions on lifting or fitness related or nutrition, anything fitness related that you'd like to see me do a video on, leave me an email with your request at the email link in the description below. And we'll see y'all next time for more health and fitness related information. Thanks guys for watching. See y'all next time.